Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Hello and welcome to episode number 12, Overview about possible MS symptoms. This time it's all about MS symptoms and giving you an overview of what can be related to the disease. Because, especially at the beginning, the variety of problems is not always clear to you. And it is important for your healthcare professional, HCP, to know how his or her patient is doing and whether, for example, the chosen disease-modifying therapy is working. Multiple sclerosis is called the disease of 1,000 faces for good reason, as it progresses differently in each patient, and there are a variety of possible symptoms. That's why it takes many years for some patients to finally receive the right diagnosis. MS symptoms at the beginning. Please be aware that most patients will have only a selection of the symptoms mentioned below and will likely encounter a few different ones over the course of the disease. The following are MS symptoms that typically occur at the beginning of the disease. Sensory disturbances, which can be numbness, tingling, burning pain. Impaired movement, which can be weakness, stiffness, clumsiness, problems walking. Visual disturbances, which can be double vision, blurred vision, decreased color perception. By the way, I had that one at the beginning. And fatigue, rapid physical and mental fatigue. I will include a map, a graphic of a lady where you can see all different symptoms and pointing to the places at the body where they are normally occur. And I will include this one into the show notes, but it's in larger size at my blog article, and there will be a link in the show notes to the blog article where you can see where it is located, because I think that's quite important as well to get an idea, especially when you are not that well aware of all these different symptoms. But as said before, over time there can be more symptoms in the long run. And these symptoms might be on the psychology side, depression, anxiety disorders, crying spells, emotional instability. When it comes to the section of movement, there can be dizziness, tremor, balance disorders, muscle stiffness and painful muscle cramps or spasm called, and of course coordination disorders or paralysis. When it comes to visual disturbances, there can be eye movement pain, loss of vision, or double vision. And then there are, of course, a variety of other impairments, which can include pain, fatigue, meaning chronic fatigue, cognitive impairment, temperature sensitivity, sleep disorders, speech disorders, swallowing disorders, sexual function disorders, bladder problems, and digestive problems. And bladder and digestive problems are normally one together, or some of the symptoms together with the sexual function disorders, people don't like to talk about. But it's very, very, very important to treat all different symptoms in order to have a good outcome for you as a whole and for your quality of life. As long as one has sufficient neurological reserve to allow the central nervous system, CNS, to compensate for damaged areas, chances are good that symptoms will partially or even completely resolve. Classically, this phase in the disease course is referred to as relapsing remitting MS. Thus, a major goal in the treatment of MS is to protect the CNS from disease activity as best as possible, starting at the onset of diagnosis. This is achieved by an individually suitable disease-modifying therapy, DMT, and a healthy lifestyle, so that the MS can be slowed down as much as possible or even stopped completely. The key word here is prevention. Of course, there are also different treatment options for all MS symptoms. An important pillar is the therapeutic approach with physiotherapy, occupational therapy, speech therapy, but also relaxation techniques and appropriate exercise like meditation, yoga, Tai Chi, or the Feldenkrais method. In addition, there are medication options for treatment, specific aids, and sometimes surgical interventions. High-intense interval training, or HIIT for short, as well as cardiovascular training combined with cognitive training, play an important role in gaining back lost functions and keep a high quality of life level. Just for you to know, I will address each MS symptom individually in upcoming episodes. One more thing. Please keep in mind, it is important to treat each MS symptom as best as possible to reduce stress levels in the body. This helps to reduce fatigue, increase quality of life, and reduce inflammatory activity in the body that can be caused, for example, by multiple bladder infections per year. With this, we are at the end of this short episode. And please be aware, I'm always happy to receive feedback, suggestions, and questions. Also feel free to send me a picture of where and when you listen to my podcast or read the post to nele@ms-perspektive.com, perspective with a K, as I'm German, or use the contact form. That makes it more of an interactive exchange. By the way, next time I will talk to Lauritz Taul-Madsen about how to prevent falls caused by MS. Lauritz is a PhD student at the Department of Public Health in Aarhus University in Denmark. And it's a very interesting interview. So tune in again and hear you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. Hear you next time.